Good afternoon. I'm Dr. Sundari Mace, Sonoma County's health officer. I'm here to share the latest updates on coronavirus in Sonoma County with you. I hope everyone had a nice 4th of July weekend. As we're coming off the holiday weekend, unfortunately, I don't have an update in numbers to share with you. However, we'll have all these numbers updated on the website later this evening. That said, we did see record high cases reported last week, peaking at 92 cases on Friday. So it's no surprise that there are several key metrics that we're very concerned about. As with most of California and across the nation, cases are surging, and this inevitably results in more hospitalizations. First off, I want to acknowledge that this is a scary and anxious time for people, especially for those with underlying health conditions and older adults. So let's keep that in mind as we go about our days and be gentle with each other. I also want to provide some reassurance that the state of California, counties, hospitals, and ancillary care services have been planning extensively for a possible surge. The efforts to address the pandemic in our state are well coordinated and supported. With that, California has set up a system for monitoring key metrics. And you may have heard this referenced as the watch list. 3 consecutive days on the watch list will trigger the closing back down of some indoor activities within higher risk sectors for a minimum of 3 weeks. Keep in mind, the data monitoring assessment is made in consideration of the state-approved county-level attestation plans. In Sonoma County, depending on how we're uniquely affected, for example, where are our cases showing up, how the disease is spreading, we may need to go beyond the state shutdown requirements or recommendations. Soon, we'll be updating our data dashboard on socoemergency.org to give you more information in order to track the situation more closely. We are getting through the weekend's data, and we are preparing for the likelihood that Sonoma County will soon be on the state's watch list. Today, I don't have a community question, so I thought I would take the opportunity to share with you what the data are telling us about asymptomatic spread of COVID. For sure, the asymptomatic nature of this disease is both positive and negative. While it's good that upwards of 30 to 40% of people who get COVID are not getting sick, the fact that people can be silently spreading the disease makes this a unique and challenging disease to contain. There's been a lot of emphasis on young adults being asymptomatic and their role in spreading the disease. However, it's important to remember that this age group is not uniquely asymptomatic. As a reminder, being with symptoms is true for all age categories, just at different percentages, that is being without symptoms. For example, in Sonoma County for ages 18 through 24, 27%, a little over than 1/4, are reporting no symptoms. And in the next age category, where we're seeing the most positive cases, ages 25 through 44, 16% report no symptoms. What some might find surprising is even in the oldest age category of 75 plus, 19% report no symptoms. We're now encouraging everyone to get tested, whether you're experiencing symptoms, had exposure to someone who's positive or not. With high levels of testing, we're better able to pick up hotspots than see where the disease might be secretly spreading. And it's another reason to make sure that you wear your facial coverings when you're indoors anywhere and not able to keep a social distance of 6 feet. So anywhere indoors, you should wear the facial covering. When you're outdoors and you cannot maintain 6 feet from others that you don't live in a household with, you should be wearing a facial covering because you're protecting the community, as you may be someone with COVID who's asymptomatic and simply doesn't know it. So do get tested and do wear your facial coverings. And I'm signing off, wishing you well, and we'll talk again in 2 days.